Namaskar, hello and welcome to the day one of IndiGlobal Cancer Care Symposium, the art of conquering cancer. This particular symposium is aimed to bring in the much needed attention and actionable plan towards the ever increasing burden of cancer in India. Cancer is the second largest cause for the deaths across the world. And in India, the burden of cancer is likely to increase from 1.3 million to 1.57 million in 2025, according to the National Cancer Registry Program. There is advancement in medical technology, infrastructure, and it is also saving several lives, increasing life expectancy. But however, the cancer burden on India and across the world is increasing. This calls for a constant review and upgraded approach towards dealing with cancer and cancer management. This particular symposium, IndiGlobal Cancer Care Symposium, which goes with the tagline, The Art of Conquering Cancer, aims to bring the key stakeholders from the government, from the hospital, and the healthcare sector organization who put together can deal and battle and conquer this ever increasing burden of cancer. So, we will have some amazing sessions throughout the day, and which will be touching upon empowering transformation for affordable and accessible cancer care, early detection, accurate intervention, and monitoring of cancer. At the same time, role of technology in taking cancer diagnosis and treatment to next level. So for this, we are in the day one in the inaugural session. So I would request everyone who is watching us through multiple platforms and including LinkedIn, Facebook, YouTube, from across the country to welcome our esteemed speakers for today. We are joined by a very well-known personality who has mastered medicine and healthcare management and has led several key positions in healthcare sector in the state of Jammu and Kashmir. And currently, he is the additional mission director for Ayushman Bharat Digital Health Mission, Government of Jammu and Kashmir. Please join me in welcoming Dr. Shafqat Ali Khan, who is the additional mission director, Digital Health, Jammu and Kashmir. Joining us all the way from Srinagar, Jammu and Kashmir. Thank you very much, sir, for joining us.
Good morning. Good morning. Thanks for having me on the show.
And joining with us from another part of our country, India, the beautiful northeastern state from Shillong, Meghalaya, we have a very special guest who represents the Government of India, Department of Northeastern Region, Northeastern Council, Ms. Sherry Lalthangzo, who is the Economic Advisor with Northeastern Council. Thank you very much, Ms. Sherry, for joining us. And from the southern part of India, we are being joined by Dr. Bipin Gopal, who is the Deputy Director of Health Services from the state of Kerala, joining us all the way from Thiruvananthapuram. Thank you very much, Dr. Bipin Gopal.
Thank you.
And we have a very special guest who is worth mentioning, who is not just heading the largest healthcare organization of our country. He is also the erstwhile cricketing star, and he is a pioneer in emergency care. He is the one who introduced the model of emergency care in India that made a huge difference. And not just that, above all, he is more relevant to this session, and besides being a healthcare expert, he is a cancer conqueror who also authored the book I Am Possible, chronicling his transformation. Thank you very much, Dr. K. Hari Prasad, for joining us, who is the president for Apollo Hospital Division, Apollo Group.
Good morning. Good morning to everybody.
Thank you very much, Dr. Hari. So, with this, I would first call upon Dr. K. Hari Prasad, President, Hospital Division, Apollo Group, to share his thoughts and perspective about empowering transformation for affordable and accessible cancer care, where we would be taking that would help us taking actionable steps towards this transformation, towards collaboration, towards public policy, and kind of a much needed awareness needed in this cancer care. Over to you, Dr. Hari.
Thank you, Sudheer, and thank you, IndiGlobal, for having me on this platform. And congratulations for what you guys are doing in terms of spreading knowledge and bringing experts onto a common platform. Now, as Sudheer has explained, cancer has reached epidemic proportions. We were all worried about the number of deaths when the COVID was at its peak. But non-communicable diseases, cancer, which is one of the most important from them, is resulting in more deaths than COVID did at its peak. But we were all worried and ran helter-skelter when COVID was at its peak, but don't seem to be bothered enough about the current epidemic which is in place. And let me assure you that no country, even the richest country in the world, has the money and the GDP to treat all the cancers that will occur if they are allowed to occur. And not only that, it's not just a health problem, but it's a huge socio-economic problem because we see more and more younger people being afflicted by cancer. We see that the bread earners of a family are being incapacitated, impacting the whole social fabric of the family. So it's not just a health problem, it's becoming a huge socio-economic problem and deserves a lot more importance and focus from all players who can contribute to tackling this menace. Now there are 8 P's which are required to handle this menace and reduce the burden of disease from cancer. The first and obvious one is prevention, then prediction, then being proactive. Now we're getting into personalized care, precision medicine, perseverance, partnerships, and policy. Within these 8 P's, it covers the entire gambit of managing and handling the epidemic of cancer. The first and the most obvious one is prevention. Today, we know that cancer is preventable. A number of diseases, a number of cancerous conditions are preventable. And I must take this opportunity to congratulate Government of India for facilitating vaccine against cervical cancer in the recent budget. But I guess a lot of such policy decisions have been taken. But I think and I would advocate that they are made mandatory rather than just facilitating or giving the option for people who are interested in taking the vaccine. So that cervical cancer is the commonest cancer in the country. It occurs in the lower socioeconomic group and many times is diagnosed in the third and fourth stages where it is more expensive to treat and is also a huge, and the outcomes are also not great. So similarly, other situations, smoking. A lot has been spoken about smoking and lung cancer and throat cancer and chewing tobacco and oral cancers. But I don't think we are yet there in terms of handling this menace and curbing smoking or chewing tobacco. It continues unabated, and the incidence of oral cancers and lung cancers is rising at a phenomenal rate. So prevention is the first and the foremost step towards handling this epidemic of cancer. And apart from uh, very stringent policy measures, I think creating awareness and creating that uh, self uh, this thing towards prevention of cancer is critical. Then we've got into a stage where we can predict cancer. All of us know that certain types of cancers run in families. And within a family, it is now possible to detect with genome sequencing and stuff like that on which family member is more likely to get the cancer, and then take preventive measures. So the genomic sequencing is now becoming a major player in predicting cancer, but very few people are opting for it. Even people, especially breast cancer, where it runs in families, where the mother has had a cancer, she's got daughters, but I'm not too sure how many of them are actually taking steps towards getting themselves tested and seeing the possibility or the risk of them getting the breast cancer. So predictive medicine should be leveraged upon, and we have the tools today, and that is the next step in towards tackling the epidemic. And one definitely needs to be proactive. There is no space, no place for being relaxed or comfortable. We have to be proactive about cancer, and proactive more in terms of prevention, and then comes early detection, and then comes proactive early intervention. Because the later as the disease time increases, it becomes more difficult to treat, more expensive to treat, and also the outcomes are also not great. Now, despite taking the best measures, cancer is bound to occur. And we are now getting into a stage, as I said, with genomics and proteomics, we're getting into personalized medicine. And personalized medicine is becoming more curative for cancer. In the past, cancer used to sound a death bell for the patient. But today, we can very confidently say that with appropriate interventions, with personalized medicine, with all the genomic and proteomic studies that have come in and the newer options of treatment, cancer is definitely curable. Then precision medicine. Today, chemotherapy is becoming more precise. The same type of cancer behaves differently in two individuals because the two individuals are different. The genome sequencing is different. So by making sure that we do the precision oncology in terms of whether it is chemotherapy for that particular individual after going to the genetic level of the disease, or whether it is more high-end radiotherapy using proton beam therapy and stuff like that, or surgical for treatment for cancer using robotic surgery to make it more precise so that the cancer management becomes very, very effective and efficient. And I think no individual or no individual organization or the government or the private by themselves can tackle this menace. This is one disease which demands partnerships between all the stakeholders. And amongst the stakeholders, the government, the public players, the NGOs, and the institutions across the system, like schools. They should be taught in the schools about the danger of cancer and what to do to prevent cancer. Because children are at the right age to absorb what is being taught. And they go back home and tell their parents, if the father is smoking at home, they definitely, children are more courageous to tell the father to stop smoking, and the father is likely to be more receptive when the daughter comes home and tells them that it is dangerous for her. So, partnerships across is a critical aspect of managing cancer, and I sincerely believe that time has come where the entire nation and even the world focuses on prevention, early detection, and precise management of cancer to reduce the socioeconomic burden of cancer and to reduce deaths from cancer and morbidity from cancer. So I'll stop there, and at the end, if there are some questions, I'll take.
Thank you very much, Dr. Hari. With this, now I'll move to Dr. Bipin to put forward, who has joined us from Thiruvananthapuram, Kerala, representing the state of government Kerala. Dr. Bipin, can you please throw light on how is the state government ensuring that it is providing the affordable and accessible cancer care to its citizens at the same time? What are the initiatives and collaborations that Kerala has undertaken and is looking forward to? Over to you.
Thank you. Initially, let me thank the IndiGlobal for inviting me to participate in this meeting. And uh, it's a very good initiative to create awareness of cancer among the public. And regarding the state of Kerala, before going into the public policies, let me just quickly rush through the burden of cancer disease in the state of Kerala. We are having a very high cancer density. The percentage of the cancer cases is actually above the national average. And as per the cancer registry available with the Regional Cancer Center Trivandrum, more than 65,000 patients are being registered as new cancer patients every year. So that is the burden of the cases in the state of Kerala. And we have all kinds of cancer, but in the females, we see breast cancer and cervical cancer as the highest one. And the males, it is the tobacco-borne cancers like the oral cancer and the lung cancer. And the state government actually prioritized the cancer care, and we have actually developed a cancer strategic action plan to tackle the menace of cancer in a very strategic and systematic manner. And the cardinal principle for this management was the availability of treatment, the accessibility to treatment, and the affordability. Regarding the availability, we have three cancer care institutes, the state-of-the-art institutes, one in the southern side, the Regional Cancer Center Trivandrum, and one in the middle part, the Cochin Cancer Center, and in the northernmost part, there is the Malabar Cancer Center. Both these three cancer centers are working as the regional cancer centers, which offer the highest end of treatment. And we have five government medical colleges, which is also offering the treatment if, under the government system. And in addition to this, when Mr. Rajiv Sadanandan was the Health Secretary of Kerala, we made a decentralized base of cancer care, which can actually, which made actually the cancer treatment more accessible to the public and more affordable to the public. So what we did was that we trained our medical officers in comprehensive cancer management, and we started district and regional level cancer care units in on all the district level hospitals and the taluk level hospitals, where we offer the chemotherapy and or the supportive cancer care treatment. So now, right now, we have 24 of such institutions functioning in the state. So the people from the remotest districts need not go to the regional cancer center or to the medical college for the treatment. They can avail the treatment in their own district or in their own taluk. So that is the first thing that we have made. And the second thing is, after the decentralization, if you look at the numbers in the current year, more than 1.5 lakhs people attended decentralized clinics in the state of Kerala. That means the people are having the financial freedom. The people are having their physical, because they need not travel a lot, and the mental happiness that they can live with their family it's also making a big difference. And to create awareness on the cancer side, we have actually partnered with the education department, the NSS units of the National Service Scheme units of the schools. We are taking these students to the regional cancer centers to have a roundabout view. And this is not just to create an awareness, but also the students can learn about the harmful effects of tobacco by seeing the patients themselves, and they also get a chance to see the cancer patients, and they at the younger minds, they develop a a passion towards cancer management and the cancer awareness. So the association with the NSS units is going on, and we have several NGO partners are closely associated with the government. So they are also taking the awareness part into the society, and we have different modes of IEC materials, and we rope in the cine actors like Mamta Mohandas, who herself was a cancer survivor, and Ms. Manju Warrior. So many celebrities are joining the bandwagon of the health services department to spread the awareness of cancer in the society. And when we talk about the policies, we made cancer a notifiable disease by a government order in Kerala. So any case of new case of cancer has to be reported to the state government. So and the HPV vaccination has been made an order, and we are piloting the HPV vaccination in two districts of Kerala, in Wayanad and in Alapi districts, and a government order in this respect, in this regard, it has been released, and soon we are going ahead with the HPV vaccination schedule. And we have a cancer board, a centralized board which constitutes the directors of the regional cancer center, the administrators, and also the participation from the private institutions also, and the Ayush institutions also. So whenever a question of a policy or a new initiative in cancer is made, this cancer board has to take a decision. So there is a unified, or there is a central unit which can decide on the policies and also the actions, the activities which has to be taken in the field of cancer management. And very recently, we have opened the cancer care management to to the private organizations and to the NGOs. Now, the private players, the NGOs, they can partner with the government in all stratas of cancer management, in the awareness creation, in the in the screening camps, in the management, and in all aspects of cancer management. All these partners can join in. And finally, when we talk about the recent advances or the technological advances in cancer care, we have a portal called Shaili application, where the ASHA workers go to the field and they screen, they survey all the people above 30 years of age. And in that survey, a questionnaire on cancer, a few leading questions on cancer are there. And all persons who have a positive answer on this cancer, they are referred to the nearest health center for management. So through this, it is done through an application called Shaili, which works on an Android mobile, and we collected the data of almost 9 lakhs people who are in the risk group of cancer, and we are started screening them. And the second thing is that we have a cancer care suite, which is also a technology, a software solution, wherein when we register one patient, throughout their course of treatment, from the diagnosis, from the management, everything is recorded in a single platform called the cancer care suite. And the third one is the telemedicine, tele-oncology services. We have we have tie up with the regional cancer centers of Trivandrum and Malabar Cancer Center, so we can have consultation with the oncologist on a tele-oncology system. And the CDAC has actually developed one telepathology unit also. The We can have the pathological confirmation using an artificial intelligence, which is being piloted in the regional cancer center Trivandrum. And recently we have the robotic surgery also in place in the regional cancer center Trivandrum. So in all the aspects, from the policy level to the implementation, Kerala government is actually moving forward with all kinds of strategies for the management of this major disease. So I will.
Amazing, amazing, Dr. Bibin. Thank you for sharing that. And I see there is quite an very interesting initiative that is collaborating with the education department and taking the young minds, students, to these areas where students are linked to the cancer treatment. that imbibe awareness about the cancer much younger. That's amazing. I think that is something that can be replicated across the country if it is not being done. Amazing, Ali. I'll come back to you. And with this, I would request our special guest who has joined us from the valley, Jammu and Kashmir, Dr. Shafqat ji. Please share with us the kind of initiatives that is being taken up in Jammu and Kashmir. Over to you.
Uh, Thank you, Sudheer, for having me in this very wonderful session with an enlightened panel. Uh, Jammu and Kashmir is also grappling with the NCD called cancer non-communicable disease. And it is as prevalent and the figures are as alarming as the other parts of the country. So, having said that, I would put it to a note that I just saw a document wherein it is written that 2017 till 2023 ending, there are 7,000 patients who visited and were detected with cancers at one hospital in Srinagar, the cancer center in Srinagar. So that is for a proportionate of around 70 lakh population. Then we have a Jammu division as well, and I think the proportion of having the numbers is as big as in Kashmir. Having said that, I would dwell into the fact that cancer is a very huge public health problem across the globe. It is consuming a lot of out of pocket money of a citizen, and it is becoming an economic disaster for socio-economic fabric of the society, especially the middle and the lower class end of the society. And it is becoming a huge problem because the burden of the disease is not only financial, it is social, it is a number of other things are associated when cancer hits any member of the family. So, in my understanding of what I've seen and gone through in the state of Jammu and Kashmir, we have uplifted the infrastructure to the level, as you are aware, that AIMS is going to be operational very soon. But having said that, we have 3 institutions in Srinagar. There are 2, and Jammu Cancer Institute has opened up, and state-of-art machinery has been put in place for detecting and post treatment for the patients. Uh, and we are going to, the government is very keen to take this initiative to the district level. As Dr. Bipin said, we are also envisaging to take our services to the district level where a person can go at least in the primary phase that he can have a chemotherapy done rather than going to a tertiary care hospital. Detection, prevention, and the other parts of the disease are also envisaged to be taken care at the health and wellness center level. And that is the preventive and the promotive part of the disease. The foremost understanding which I have about prevention is that cancer somehow is probably related as a lifestyle disorder also. As one of the panelists said, smoking. Smoking is a lifestyle disorder. It's a lifestyle. Food, nutrition, I feel is going to be a very huge challenge. We have to see what we eat. Nutrition, is going to be a very, very important part of our daily lives, which will affect our gut, our colon. Our colon cancers are huge in our country. And in J&K also, you will see colon cancers all across the board. So there is something wrong in the food also we take. We don't know the value of nutrition. People know that they have to go for a walk. People don't know they have to do yoga, meditate, but they do not know what where is the carb, where is the protein, where is the fat, and where is the vitamin. So I think in the awareness part of the NCDs, all NCDs, irrespective of the cancers, the hypertension, diabetes, and other diseases, I think food and nutrition will take the front seat, and then we will go segment wise to the other measures which we need to take. As I have already said, the problem is also about the pollution and the air we breathe, the water we drink, it is all related. That is one part. Then we also, as Dr. Hari Prasad said, Hari Prasad ji said that it is a need for partnership. It is not that only the private sector or the government sector is responsible. We have to build partnerships across the board, government, private, semi-private, NGOs may be of great value and help, and so that we will have a concerted and joint effort to go down for early detection of the disease, because early detection will be a key to number one, treatment, and then increasing the life expectancy of the person. And in that, having said that, diagnostics are going to play an important role. Suppose if there is cancer and a person is not diagnosed on the right time, through the right machine, through the right person. So I think that is also a benchmark we have to cover, that the right diagnostic equipment is placed not at the district level, but at the state level, at the tertiary care hospitals, and wherever it could be possible. Then one part, digital part, is the artificial intelligence. I think artificial intelligence will play a very great role, especially in cancers. We have artificial intelligence tools for detecting cancers in the blood, the markers. We have artificial intelligence tools in X-rays, in CT scan machines, and the diagnostics which are using back and forth. So, having said that, I would stress upon use of artificial intelligence wherever it is possible to speed up the process of diagnosis, because sometimes diagnosing a disease also through the diagnostic procedures and processes takes time. So if there is an artificial intelligence tool which can detect the disease earlier, you would start treatment earlier, you will end up doing good the patient earlier. His expectancy of life will increase, the quality of life will increase. So I think that is all I would say right now. We will continue the discussions further later.
Thank you very much, Dr. Shafqat. And now I would call upon our special guest who has joined us all the way from the beautiful state, Meghalaya and Shillong. Uh, Ms. Sherry, we would like to know the kind of initiatives and the special focus. We have a special ministry now, Department Development of Northeastern Region, in order to bring in some special attention to the Northeastern region. Can you please throw some light the kind of initiatives and the awareness and the kind of prevalence of cancer cases in Northeastern states? Over to you.
Thank you, Sudheer. Thank you for this opportunity to be with eminent people. I think I am the the last person who knows anything about any cancer, what is happening in my body, apart from the experiences that I have had of my relatives and my near and dear ones suffering cancer. Thank you so much, Mr. Hari Prasad, Dr. Bipin Gopal, and our esteemed colleague from JNK. And we were enlightened with your data, with your insight into cancer, which is, if I say, Northeast also one of the highest states, highest area where cancer is prevalent. So if all the states come together, I think all of us will say that cancer is highest in my state. So this shows that cancer, the cancer in all form is very, very high in all the states. I mean, I can feel that, because the data that is in front of me and the write-up in front of me also says that Northeast has a very high incident of cancer, which is probably higher than in some cases, in some states, higher than that of the country. So having said that, initiatives taken up in the states are, I'm sure, many, but Assam has gone a little bit ahead for us in the ER region with, we have helped setting up the B. Barua Cancer Institute in Assam. That is one of our, if I say NEC's intervention, that would be one of the biggest intervention that we have had. But apart from that, we are also doing many number of things in all the states. Not to name them like one by one, that's going to be boring. But yes, Assam is also coming up with around 14 cancer hospitals in Assam, in association with Tata Cancer Care Foundation, which is a big initiative, I feel. Now, how to take this forward to the other states? We were talking about our Dr. Bipin was talking about the activities that is happening in Kerala, which is like, amazing. The setup in the districts at the district level, the roping of the students in that early age of cancer awareness, and which is so important, that the one that we see on TV is like, okay, you have cancer because of tobacco, but it's just with passing reference. But when you really go and see, maybe it will be really, really helpful for us also to take the school children to hospitals, cancer care hospitals, to be aware. If you're aware at that level, I think that remains with you for the rest of your life. So that will help you in whether you take excess tobacco, excess drinking. We're talking about excess. I'm not talking about moderate and don't do it at all. This is not, we are not preaching. We are not preachers here. But it is so important to expose our people to all the thing what is happening. Now in the Northeast, when I don't even have a dialysis machine in some of the district hospitals, it's, I mean, I don't know, it's still a long way to go for cancer which has not happened, which has not been diagnosed, to be aware, but then has to be taken up. So if the figures I can, this is profile of cancer and related health indicators in the Northeast region of India, ICMR data of 21. Like we have heard, incidence of cancer is very, very high. Esophagus for male and female both, cervical, breast cancer, these are all highly prevalent now, because of I'm sure it's because of the tobacco that we eat, or whatever that we consume, or the smoke, food that we cherish so much, and the soda that we eat, which is, in many places that is one of our staple diet, which is put in one of our dishes. So these are all, cancer awareness is so important. Now, how to take this forward to the states and to the district level is one thing that I feel we need to do at this level, of maybe a mobile unit kind of a thing. I don't know, mobile unit kind of a thing where we go at the district level and maybe create awareness again and again. Um, Checking now, I check myself regularly, in the sense, because I'm a government employee. people in Guwahati, the people in Guwahati, the normal people in Guwahati, those so many cancer institutes and hospitals are there. I don't think we will go and get ourselves check up in any form for cancer unless there is a special thrust, like in the universities we used to have. In Delhi University, we used to have this cancer checkup weeks. Like that, I think that outreach program of doing these things has to be, I mean, cancer awareness week or cancer checkup, you need in mobile vans, has to be, I think, taken forward. That's what I feel. Now, how do we help each other in this? Maybe we need the expertise of our esteemed states, which has implemented, like Kerala government, which has implemented quite a number of cancer care control strategy, in fact. So I believe you have the cancer control strategy in place. You have a cancer board also. Meghalaya, I heard, is talking about cancer policy. So this has to be taken out, some kind of a strategy, some kind of a policy, which maybe which is there for now. For a diabetic patient, um, there are something like do's and don'ts. Something to eat in the morning, something to eat daytime, some that balanced diet kind of an SOP. It is available now. Maybe I have not checked so much. Is this available for cancer prevention, cancer treatment to the public? I have not really checked, but then if that is not there, I think then we need to have some things in place, some kind of SOP, some kind of I don't know, social media kind of a thing where we inform or information is widely available for anyone to access. Looking forward to IndiGlobal. Thank you so much for organizing this. Looking forward to a session, especially for the Northeast, where we have all the people, maybe physical would be nice, uh, so that we can have sharing of experiences and sharing of experience from the advanced, maybe states and advanced countries where these things, I mean, some things are in place, so that we can take it forward as an example kind of thing. Thank you so much.
Thank you, Ms. Sherry. With this, as Ms. Sherry Lalthangzo has mentioned about the special edition, IndiGlobal, in association with the Ministry of Development of Northeastern Region, Northeastern Council, we shall come up with a special edition of second IndiGlobal Cancer Care Symposium 2024. We shall be communicating the dates soon. So this was this thing,
Yes,
and
I just forgot. Yeah, thank you. Yeah.
yeah, over to you, Ms. Sherry. Would you like to mention something on this part?
No, thank you so much. Actually, we had planned this, but then something happened, and then we thought we may take up the issue first, so that people would be aware and the importance of this cancer care and cancer awareness everywhere is expressed. Now, the probability of just one more data, the probability in the Northeast of male having cancer is 1 in 4 in Kamrup urban. I mean, you would not know. And in Mizoram, it is 1 in 5 for male and female, which is like very, very high. So, what to do? This is the right time, and I mean, we already very late. But then, not. I mean, every time, I'm sure it's better late than never. So let us take this forward. I request our esteemed members here also to kind of help us out in reaching out and talking about this cancer to our people. Thank you.
Thank you, Ms. Sherry. Now, there are a couple of questions in the audience, and also these particular question. First, I would come to Dr. Hari. Dr. Hari, there are certain questions which are does cancer help cure? Does vaccine help cure cancer? That is one or combat cancer. And one more thing, there are modern, besides the traditional treating methods in cancer, which is chemotherapy, radiation, and all. There are certain, as you mentioned, like gene therapy and immunotherapy. This is the second part of the question. Is it happening in India, and to what extent is it affordable and accessible? Over to you, Dr. Hari.
Yeah, first of all, we talked about the HPV vaccine. We all know that cervical cancer, the cause is the HP virus, human papilloma virus, and preventing the infection with the virus with you by using the vaccine definitely prevents cervical cancer. So that is one cancer which, as I said, is one of the most prevalent cancers in the lower socioeconomic group, and that is preventable with vaccination. And there's absolutely no doubt about it. And it is extremely pleasing to know that the government of India has taken up the cause and is facilitating and has promised that large scale immunization with the HPV vaccine will be in place. So that is one, that's about the vaccines. The second thing is about the newer forms of treatment. There, all the newer forms of treatment are available in the country. Everything, whether you take it as immunotherapy, CAR T cells have now become available in the country. You've got everything that is available in the world available in India for treatment. When it comes to treatment, there are two parts of access to treatment. One is the geographical access to facilities which have the latest and the cutting edge technology. And I think we are far behind that in terms of cancer care. And as Madam from Northeast said, there's a lot that can be done, that needs to be done in the Northeast in terms of providing geographical access to good quality cancer care. And the second part of it is the financial access. There is, I mean, cancer has been documented to be one of the causes of rural indebtedness in the country. It is documented. The statistics are alarming. Treatment for cancer actually pushes families into poverty, and they sell everything they have. They take loans for treatment. So it is expensive at this point of time. For example, a CAR T treatment or a proton treatment, it costs lakhs of rupees. So creating that financial access is the real challenge, where all the stakeholders need to work together. One, in terms of creating geographical access. Two, in terms of bringing down the costs of treatment. Three, in terms of providing the financial access that is required to the poor, economically poor people, so that they have the access to the best form of treatment. There's no point in having the infrastructure and the capability and the skill sets to deliver the best that is available in the world, with a major section of the population not being able to access it, either geographic because of geographic limitations or financial limitations.
Yes, Dr. Hari, this remains to be a challenge, and we are known that Apollo is also known to take the healthcare services to the remotest place, even the high range areas. So, what kind of collaborations that can happen with the government, with the private players? How do you look at it?
I think we've been working with the government in multiple places. For example, telemedicine is one area, telepathology is another area. And one of the things which we regularly do, as I said, prevention is the best, early detection is the next best. Now, we've spoken so much about cervical cancer. And to detect cervical cancer, pap smear remains to be the gold standard even today. That is, you actually go to a place where women are there, take a vaginal smear, make a slide out of it, and then some pathologist may not be in that location, has to read it and then report it. And by the time the report comes back, you would not be able to trace the person at all. So what we've done is we've used, as the gentleman from Jammu and Kashmir said, artificial intelligence, where there's a high resolution camera which actually takes the picture of the cervix, sends it into the cloud. There's an AI algorithm in the cloud which it gives the probability of the individual having cancer instantaneously. So you are not actually waiting for a pap smear report to come to catch hold of the patient with cancer in the early stages and treat them. So instantaneously, you would know who is at a high risk of treating cancer. And this we are using extensively in camps across the country. And I think there are similar solutions for other types of cancer. Now we've seen solutions where just the saliva is, being used to diagnose early stages of oral cancer. So there are multiple new techniques using whether technology or artificial intelligence and machine learning. But I think the most important thing is to create awareness so that people actually either prevent cancer, or when these sort of solutions are available, they use these solutions to the best effect.
Thank you, Dr. Hari. Now I would come to Dr. Bipin. Dr. Bipin, as you mentioned, the cases of cancer in Kerala is relatively higher compared to the national registry, national cases of cancer. And is there anything that you could figure out what is the cause leading to any particular cancer in the state of Kerala, and the kind of collaborations you are looking at? Uh, Amazing work that's happening in Kerala. However, what are the way ahead that the state government and the machinery in healthcare department of the state is looking ahead and is working on?
Regarding the etiology of the cancers, almost all kinds of cancers are there in Kerala. The exact reason to why this happens in Kerala is not known, even though there are many studies which have been done by the Regional Cancer Center of Trivandrum. The exact reason why the the incidence of cancers are high in Kerala is not that known. But one factor is that the life expectancy of the state of Kerala is quite high. It is now nearly 75.6. That means 73 years for males and 80 years for females. So age itself is a risk factor for cancer. So as the age advances, there is definitely a chance for getting cancer. That may be one reason. And the predominant food habit of the Kerala is non-vegetarian, especially in the northern side of Kerala. The predominance of non-vegetarianism is there. So that could be one reason, but the exact cause, especially the incidence of breast cancer, why it happens, that is not really known. So the government is actually taking up this seriously, and like what Harisar has told, there are technologies available. There are new technologies available for the detection of cancer. There are new technologies in the management side, in the treatment side, in the surgical side. But the limiting factor is the economics,
Yeah.
the cost factor. So how to tackle that cost factor is a big headache for the government, because all these newer technologies, all these new advancements in the cancer, it comes with a big price. So unless and until we provide this technology to the poorest of the poorest, this technology is not going to help the population at large. So this is where we have to bridge this gap by associating with the insurance groups, or there should be a kind of fund stacking from the philanthropists or people like that. Some sort of financial accumulation or a fund sanctuary has to be created for the management of the poorest. There are immunotherapies which are coming up for breast cancer, for cervical cancer. So there are advancements, but this needs to be translated to the poor. Otherwise, if you look at the state of government, the state of Kerala, the policies are in place, the human resources are there in place, the technologies are there. So what we need is a, a financial solution, a financial freedom, a flexibility for managing these patients. Uh, that's it.
Thank you, Dr. Bibin. Now I come to Dr. Shafqat Khan. Sir, you are already leading the digital health mission Ayushman Bharat, and you have also worked in terms of you have headed as the CEO for healthcare infrastructure in Jammu and Kashmir. Everything boils down to the economic crisis in terms of the uh, accessibility of these modern healthcare treatment to deal with cancer. What's the solution you look at it?
Sudheer, I was precisely wanting to, dwell on the subject of the huge cost and the burden, economic burden on the patient. Poor, middle class, rich, everybody gets the burden of cancer. There are some people in the rich class as well who feel the burden because the cost of number one, the diagnostics, then the treatment, then the chemotherapies is so high that uh, generally a family gets into debt. Burden of the financial burden is so high that the entire family is affected, for the rest of their lives. So in my understanding, number one, there is the chemotherapeutic drugs which are available. There's a huge difference in the element of where it is manufactured, from the manufacturer to the citizen to the patient. The cost varies so much. There is tremendous hike, at the manufacturer's factory and the retailer's, selling price. Sometimes it is 100%, sometimes it is 500%. You will be amazed to know this. This I have also understood during the various meetings, various, people I've met at different forums, wherein we had manufacturers of cancer drugs who basically manufacture them. So the cost of drugs, their patenting, their copyrights, and their availability to the patient has to be regularized and to be monitored. Number one. Number two, I think the health insurance of the country, the PMJY, Prime Minister Jan Arogya Yojana, has played a huge role in overhauling the healthcare scenario of the country. It is a dream come true for a poor man who is, at least the entire family is assured till a insured till a 5 lakh premium. And we have a universal health program in J&K, luckily, where all citizens are covered, the entire population of J&K, irrespective of the size of family, pre-existing diseases. But the threshold of expense in a cancer disease like cancer always goes more than that, and that is where the problems start.
Yes.
5 lakhs are spent within the first, a couple of months only because he's going to diagnostic treatment and all. We will need to develop some kind of specific, health insurance policy for the cancer patient where he can sustain the kind of diagnostics, the treatment available, and the long-term chemotherapies or the radiotherapies you might need to take, or even the HPV like the vaccination dose. These all need to be government funded probably so that a patient, at least in the below poverty level, or the strata of mid to low income families can sustain such a blow on their family. So this is probably, or there may be a revolving fund with the states, federated level or at a central level, where patients could be given some kind of assistance. Because I've virtually seen people struggle through cancers. and that will be the key to managing the plight of a lot of people in our country. So that is with regards. But having said that, this is one part. I would again stress to the prevention part, and I think human body has a great tendency to rejuvenate itself, to recover on its own. Naturopathy, healing, and all the meditation, yogic practices which were followed in earlier life, the occupational hazards, the hazards of life, these diseases which are occupation related, we can stop them by getting into this way of addressing our problems through nature. Come close to the nature, eat natural, organic, eat that what is good for you, and that is where we will have the nutrition part and the experts in the field of food, nutrition, well-being, who could play a huge role in shaping the future of our country.
Yes, yes. Thank you very much, Dr. Shafqat Khan, for sharing that. As right, that prevention is the first thing. Now, there are many advancement in technology, a lot of treatment, but that comes with a cost. So it is the prevention and at the same time the lifestyle changes in regards to and further the collaboration of best practices. Before we come to the end of the session, I would like to take a 30-second response from each of the speakers. Dr. Bipin, over to you. Your 30-second response to our viewers across uh, the country.
Yeah, can you repeat the question? Say just.
Uh, Before we end the session, want to have your 30-second response to our viewers who are looking at this burden of cancer.
Yeah, um, yeah. There are many things that we can do. One is to prevent the cancer by our lifestyle changes. We can do a lot of things by modifying our diet, by doing exercise, by by reducing our stress. We can reduce the incidence of cancer. And the second thing is early detection, which is very important. Downstaging of the cancer is very important because in the case of cancer, cervical cancer, oral cancer, and breast cancer, all these three cancers can be detected very early with the precancerous lesions, and these cancers can be treated very completely if detected early. So one is awareness, second is the early detection, and third one is the treatment. So whenever you detect a cancer, treat the cancers very early and spread the awareness of cancer in all kinds of media, especially the effort taken by IndiGlobal to spread the awareness of it's fantastic. So that's it from my side.
Yeah, thank you, Dr. Bipin. Ms. Sherry, anything that you would like to call upon to the experts or something?
Yeah, thank you. Thank you. Thank you all again for this time. Now, like Dr. Hari was saying, Hari sir was saying, early detection. Like cervical cancer, you can take a photo and send it. So I think for places like the Northeast, it is hub and spoke model kind of a thing which we require, because every place in the districts and far flung areas it may not be possible to go and station that kind of an equipment. I mean heavy equipment like that. So this hub and spoke model of how to detect cancer is what I think the first step we can take. But for that, maybe your suggestions on what kind of things can be done, which is maybe not at very costly at this point in time, but some 4, 5, 6, 7 kind of intervention that we can do. Maybe that can be shared with us so that maybe that can be taken forward. Thank you.
Thank you. Dr. Hari, your 30-second response to our viewers. Those who are
I
looking.
just want to say two sentences. One is cancer is preventable. Two, cancer is curable. All it requires is a transformative focus from all the stakeholders.
Thank you, Dr. Hari. That gives us hope and positive approach towards this. Dr. Shafqat, over to you. The 30-second response from you.
I will second Mr. Hari Prasad in saying that cancer is preventable, absolute preventable, and it is curable as well. And I would lay more emphasis on the preventive part. If you really want to, prevent cancer, you need to have a healthy lifestyle. You need to see what you are eating. Are you balancing between work and home? Are you giving time to your family? Are you perfecting your own ecosystem at places? I think it is about regularizing your regime, your work habits, your time for sport, time for other activities, and I think that's the preventable part. And preventable after that is the detection part. Detection, the best is to detect early, and the government and the semi-government institution should lay a network of such diagnostic tests as it was already mentioned, that you have saliva, you have primary blood tests which can start giving you some kind of identification that you have cancer. So you take people faster to the diagnostic system. That would be the challenge for the governments, so that early detection takes place and the life expectancy and quality becomes better. That is all I want to say.
Thank you. Thank you, Dr. Khan. Ms. Shari.
I just also want to mention here that from experience, this Ayushman Bharat scheme is really helping our cancer patients, at least, up to that level that they are helping. Really, I mean, maybe it's not the right forum to thank the government, I can't, but then just wanting to also express that this is one thing which has really helped the cancer patients from my own experience.
Thank you for sharing that, sharing this message. Certainly will go across the country as you will be coming up with a symposium report. With this, IndiGlobal Media Network would like to thank each of our speakers who took out time. This is a small token of appreciation in the form of a certificate. I would request Aman. First is Dr. C. Hari Prasad, who is the president and who is also a pioneer in emergency care, for taking out time. Our heartfelt gratitude for your participation, sir, as a special guest speaker, and building awareness and enhancing education is greatly appreciated, which aligns with our mission. Thank you, sir. Next is our special guest from Kashmir, Srinagar. Thank you, Dr. Shafqat Khan, for taking out time and sharing the kind of initiatives. We are thankful to you for sharing those insights, and we look forward to collaborate and bridge the gap and the same thing. And also our special guest who joined us from the state of Kerala, Thiruvananthapuram, Dr. Bipin. We are amazed with the kind of initiatives that's been taken up. I'm sure when we are doing some special edition in some other states and also Northeast, we would like to have you there. Thank you very much. And also, Ms. Shari, thank you for joining us and bringing the scenario and picture that's happening in Northeastern states. And we are looking forward to the special edition Northeast of Cancer Care Symposium. With this, thank you everyone for joining us. We will soon get in touch with you, since it's a long-term mission to take things ahead, raising awareness and building education. Thank you very much.
Thank you. Bye-bye.
Thank you all. Thank you all.
Thank you. Thank you very much.